A lot of patients come to me with the dilemma of whether to get a bypass surgery done or a stent inserted, as different doctors advise them differently and they get confused. And I'm here to give you a few guidelines and how to decide whether a person needs a bypass surgery or a stent. My name is Dr. Dikshit and I'm a practicing senior cardiac surgeon in Arihant Hospital, Belgaum. Whenever we doubt that a person has got a heart disease or what we call as coronary artery disease, which leads to heart attack, we do a test called coronary angiogram. And in the angiogram, we usually visualize the coronary artery. Coronary arteries are the arteries which supply blood to the heart. Then we see them, whether there is a block, how many blocks are there, what is the length of the block, whether they are short segment, long segment, multiple blocks. And also we see the heart function, because with every heart attack, the heart function goes down. So whether his heart function is normal or his heart function is compromised. So all these data are necessary to decide whether this person needs a bypass surgery or a stent. Now, a few of the guidelines that we usually follow is that if the blocks are involving one or two arteries, and if the person requires one or two stents, then we normally advise them to undergo a stent. If the patient is very young or he is very old, where the surgical risks are high, in those cases also we advise him to undergo a stent, because stent does not involve any cutting. Now stents are like putting a metal spring into the area where there is a block. So what is done first is that a catheter is passed into the coronary artery, they cross the block, and then a balloon is passed over the wire, and in that area where there is a block, the balloon is inflated and the block is opened up. Now if we just leave it like that, again the block will recur because it will collapse down. And that is the reason, in order to prevent collapsing, we put a metal stent, we put a metal spring in that area so that it doesn't collapse. And by this, the path which was obstructed opens up and the blood flow is easy. Whereas in bypass surgery, what we do is we go beyond the block and join a new blood vessel or a conduit, which we call, so that the blood takes a new route, bypassing the block, and then re-enters into the same coronary artery, supplying the blood. So that is the difference between a stent and a block. So if the blocks are multiple, say more than 3, or more than 3 blood vessels are involved, or if the blocks are long segment, or if the blocks are multiple in a single artery, or if the main artery is blocked, what we call as left main. Now the left-sided coronary artery arises from a single trunk, which is about 1 centimeter, and we call this as a left main, and then it divides into 2 parts. So if the main trunk is involved, then we say that it is a left main disease. And if the person has got, due to repeated heart attack, his heart function is poor or his heart function is not normal, then we advise such people bypass surgery. So if more than 2 stents are required, or if 3 stents are required, or more than 3 stents are required, we normally advise bypass surgery. So there have been a lot of studies done, there are a lot of research done, and these are the recommendations which have been given, that a triple vessel disease, that is all the 3 arteries are blocked, left main disease, and people who have got left ventricular dysfunction, that is when the heart function is poor, in those situations we advise them bypass surgery. Even if a person needs a stent, but if technically if it is difficult, because if it is a kinked artery or if it is a tortuous artery or something like that, then we prefer to do a bypass surgery on these patients. And if we are doing surgery for some other reason, like a valve replacement or something like that, and even if he has got one block, then we prefer to do a bypass surgery, because anyway we are operating him. So at the same sitting we can do the valve replacement as well as the bypass surgery. So in short, I would say that it is not very difficult to decide. If your doctor tells you that you have got two blocks, they are short segment block, your heart function is normal, either you are too young or too old, and angioplasty is straightforward, then the best option would be angioplasty. But if more than 3 arteries are involved, and if there are multiple blocks in a single artery, or if the main artery, which we call left main, is involved and your heart function is compromised, plus you have got some other surgery, cardiac surgery procedure, concomitant cardiac surgical procedure is advised, in such cases bypass surgery should be done. So this is a basic thing and this is a simple formula, and I think most of the time these things work. But in case you are still doubtful whether you have been given correct advice or no, you can always take a second opinion and then decide what is to be done. Thank you.